that easy. Right colon, transverse colon, left colon. And so right here is that superior mesenteric artery. Okay? And notice it's giving a branch that's coming like this and right to here. And this is going to this middle part of the colon, so that's your middle colic artery. Right there. Right colon has this branch going to it. What do you want to call that? Right colic artery. Right colic artery. Now, where the small intestines hooks into the first part of the large intestines, right here, this is called the ileum. This whole this distal part of the small intestines, and this is the cecum. And so this would be the ileocecal valve, and so this is the ileocecal artery right here, coming right down into that area, because it's going to the ileum and the cecum, ileocecal. So, middle colic, right colic, ileocecal. Now, the inferior mesenteric.
Is the ileocecal also called ileocolic?
Yeah, ileocolic, yeah. Let's go with what's in your lap of ileocolic. You'll see it says ileocecal too. We'll go with you guys, ileocolic, since it's there. Okay, so inferior mesenteric artery is the third branch. It's in the midline, right there. Here it is right here, inferior mesenteric. It gives a branch over here to the left colon, so we'll call that the left colic. There's actually sigmoid vessels, and there's actually, off of there's branches that go to the superior part of the rectum, superior rectal vessels and stuff like this. So we'll just worry about those. Okay. Okay, so the branches that are coming off the sides, okay, you've got the ones going to the kidneys, and they're the renal arteries. So this one here is the right renal. Over here is the left renal. You can see them here on these models here. This is the right kidney, so here's your right renal. Here's your left renal. You can see them here too. See this red one here to the right kidney, right renal? And over here, left renal. Okay? The other two branches, the other branches that come off on the sides are the gonadal arteries. And they're going to the gonads. So in a male, we would call them testicular arteries, and a female, ovarian arteries. And they're branching all the way up here. Here they are right here. These two branches right here. So this is the right gonadal, left. You see how it travels all the way down like this. It's going to stay in the pelvis for the female. It's going to go through the ilioinguinal canal and out into the scrotum for the male. Okay. So the reason they're up here is because this is where your ovaries started. This is where they first started developing. They were all the way up here, and they migrate down. Okay, and they drag their blood supply with them. Okay. So those are the gonadals. When we do reproduction, we'll see them on the reproduction models on the hemipelvics over here. And there, if it's a female pelvis, you can call them the ovarian artery. In the male, it would be the testicular artery. Okay? So, lumbar arteries. These are coming off the lower part of the abdominal aorta into the back to feed the spine, the lumbar area. The only place we see these arteries on any models are right back here. You can see them on both sides here. There's 3 of them here and 2 of them here. 3, 2, 3, 2. Those arteries are the lumbar arteries. Real critical arteries for AAA repairs. AAA is abdominal aortic aneurysm, where the aortic aneurysm gets real big and can rupture. So they go in and they cut it open and they put a sleeve in, they sew it in. Well, they have to sew those lumbars closed. And guess what? In some people, it knocks the blood supply off the spine. And so one of the risks of undergoing a AAA repair is paraplegia. You come out of the OR without being able to use your legs. That really sucks. Okay, we okay so far? Now, this aorta is coming down, and up here before the pelvis, it splits, divides. The terminology is bifurcate. Bifurcate. It branches. And they change name as soon as it branches. And so this is the right common iliac, left common iliac. Right common iliac, left common iliac. Right common iliac, left common iliac. Now, the common iliac now branches. One branch stays in the pelvis and goes like to the bladder, the uterus, and all that. That's the internal iliac. One stays on the outside and is going to go into the anterior thigh, and that's the external iliac. So as you look at this, you can see where it branches right here. So this stays in the pelvis is the internal iliac. This one out here is the external iliac. Can you guys see it from over there? Internal iliac, right there, external iliac. Same thing with this guy. You can see him branching right here. Internal iliac stays in the pelvis, external iliac. Common iliac, internal iliac, external iliac. Now that iliac travels underneath this ligament here, ilioinguinal ligament, through the inguinal canal. And as soon as it crosses that, it changes name and becomes a femoral artery. So here's your femoral artery. All the way down. You can see it going down here. Now what it does is about this part of the thigh, it goes through that big adductor magnus muscle. There's actually a little canal it goes through. And it comes into the posterior part of the leg. So here it is. It's gone through that hole. As soon as it passes through and gets on this side, it changes name. It is now the popliteal artery. So popliteal artery here, femoral artery here. Okay? So the artery is behind your knee, and you can feel that pulse behind somebody's knee. You just grab your hands, put them in the back of their knee, and you can find that pulse. That's the popliteal artery. Now as it comes down into the back of the leg, this artery right here, it actually wraps around this medial malleolus here. This is the posterior tibial. Posterior tibial. It sends a branch through the interosseous membrane, and that's the anterior tibial right here.
It changes when it crosses the knee.
Yeah. Well, it changes. Yeah. So for posterior tibial, you know, this is really kind of still popliteal right here. I would point it down here. And so this up here is going to be anterior tibial. Now this anterior tibial comes out onto the dorsal surface of your foot, on between your toes. You can find that pulse between a couple of your metatarsals. And so you can feel a pulse right here. Okay? That's your dorsalis pediis. Dorsalis pediis right there. This actually looks like, this is what it is. It's actually a muscle though, if you look at the key, but we can call that an artery right there. That's about where it's at. That's actually an artery that if you, especially if you're in nursing, you've got to know that artery. You've got to find that pulse. You also have to be able to find the posterior tibial over here. And you'll actually get nurses' orders saying to Doppler this artery and this artery every 3 or 4 hours after people come back from vascular surgery to make sure that that artery's open. So you actually will use that. You'll use the posterior, the popliteal too.
So you said Doppler?
Yeah, Doppler.
What's that mean?
These are little handheld like ultrasound devices, and you put them on ours, and you can hear them. And so they're all the nurses' stations have them. Dopplers. You put like stethoscope ears in, and you just put it on there, and you can hear it. So a lot of times you can't feel a pulse, but if you can Doppler it, you can hear it. You're okay. You know. So. I think I covered all those arteries. Did I miss anything? Now, this guy here, vein man. Okay. There's 3 of them over there. I don't spend a lot of time with these, but I'm showing you that they're available to you. Some people use them as kind of help them to learn these arteries and veins. To me, it's unrealistic. It's interesting. Whoever came before me really liked them. They bought 3 of them at a tone of about $1,300 a piece.
Oh my God.
1,013.
More than my car.
Professor Thomas likes them a little bit, so she will usually tend to put one of these in the lab practical, the last lab practical. it's something simple that both I can figure out and you can, I may leave it there. Most of the time I switch it out and take it off. You know. But I just want you to know about them, that they're over there in the cabinet underneath the heart. If they help you out in some way to learn your arteries and veins, great. You know. If you're going to see them in a test, the most you would see is 1 or 2 questions on it. The likelihood of that isn't very high. Okay? But I have found some of my students do get an advantage out of using them. You know. So it's whatever you want to do. Okay? Any questions about that?
Can you explain how, when you talked about the blue and the red, when you talked about the and descending and ascending, can you just go
Yeah,
down?
so, again, arteries are leaving the heart, so they're being pumped by the ventricles under higher pressure. Veins are coming back in low pressure and bringing blood back to the heart. The difference between red and blue is the amount of oxygen that the hemoglobin has. So if your hemoglobin is fully loaded with oxygen, the blood tends to look red. Okay? If you remove some of the oxygen off the hemoglobin, it changes color into a more blue color. So red means blood that's oxygenated, has fresh oxygen in it. Blue means that you've gone through a capillary bed somewhere and released oxygen into the cells. Okay? So in the systemic circulation, okay, well, let's start. The heart, the blood coming back to the heart from the systemic circulation is going into the right atrium, into the right ventricle. That squeezes into the pulmonary trunk and goes to the lungs. So that's all blood that's come back from all the organs in the body, and it's going to be blue. It doesn't have as much oxygen in it. That's filling up the right side of the heart. And you're pumping that into the pulmonary circulation. So that blood leaving the heart is in the pulmonary trunk and pulmonary arteries. That's going to be blue. Now it goes through the capillaries in the lungs, picks up oxygen. It's coming back to the heart on the left side into the left atrium. And it's red, but those are veins. Those are pulmonary veins coming back to the left atrium. And you're filling the left atrium, left ventricle. The left ventricle squeezes into that aorta, and that's red. And now that's taking the left heart's pumping fresh oxygenated blood from the lungs to the rest of the body in the systemic circulation. Does that make sense? Does that answer your question? I just give us a chance to review that again. What time do you guys get done today? 10:50. Okay. So, spend a little bit of time looking at this stuff. I'm going to leave it out here.